We need to have you come down if you have anything to say. Get it on the record.
I think I speak for both hospitals. We appreciate the county's support for this Soul Community Program, and it's a very important program for all of the residents, not just the unfunded patients. Everyone benefits from the Soul Community dollars, and I recognize you have to balance what your GRT is. I think funding Mountain View at 100% makes a lot of sense. They're in a different bucket than we are, so I think that's very important as both hospitals try to grow their base. I will just say one thing, just hearing the previous presentation. Last year we added 100 jobs at Memorial. Our salary, wages, and benefits and contract labor now is $78 million. So we are part of the engine that's driving the economic development, the healthcare area. So I thought that was kind of interesting. But again, we appreciate whatever you can do.
Thank you very much.
Madam Chair.
Commissioner Garrett?
Mr. Herzog, if I could just follow up on your comment. I very much appreciate the work that your hospital does as well as Mountain View. We get in all these complicated formulas and discussions about, the numbers, and they're very big numbers and so forth. But can you help us kind of ground this? You talk about how it's important. How does money get used? What actually happens that improves the quality of life for people here?
The money comes into the hospital and really comes into, for example, our general fund. So we use it and it gets spread out across all areas of the hospital. One of the things that we do at Memorial is we do have what we call our Indigent, our IHC funds. And for those IHC patients, we essentially cover the cost of their care, in-hospital care. And we also pay the professional fees, the doctor's bills, for their in-hospital care. So that's one of the items that directly goes to the indigent patients. Another, what we do is there are certain services of the hospital, for example, our residency program. These dollars are integral in funding the residency program. I will take just a second on the residency program. And I'm going to say these off the top of my head, so they're close, but not probably 100% accurate. But I believe last year we treated 17,000 patients in the family medicine residency clinic. Those are generally, oftentimes, our unfunded patients where we try to keep them, get them in a medical home so they don't come back into the hospital. We also, we wound up with our residency, we have 18 residents. It's a 3-year program, 6, and 6. These are family medicine doctors that we have at our own residency program. Over the last 3 years, 85% of those physicians have stayed within our service area in primarily Doña Ana County. So that, again, helps them get their education. This year, for our intern slots, we have 6 intern slots. We've had over 900 applicants across the country for people to get into our residency program. So that's another. The expansion we've done in our cancer program is another thing where we have invested. We've added neonatology coverage to the hospital. So different areas of the hospital benefit. We do pay physicians to cover the ER, not the ER physicians, but the specialists, and that's another one of the areas. But essentially, any patient that comes into the hospital funds this. And this is really a UPL. It's based on the UPL, which is how the program keeps growing. And that's the difference between what Medicaid reimburses compared to what Medicare reimburses. And as the states has not been able to keep reimbursing Medicaid consistent with Medicare, that UPL number keeps getting bigger, and that's what you deal with on the supplemental that grows the base.
So would it be fair to say that everybody benefits?
Everybody benefits, absolutely.
Yeah. Thank you very much.
Thank you. Any other questions or comments regarding these items? All right. Ms. Sierra, anything to add?
The only thing to add is that if we go with method 3 that was just presented, we would have to make some modifications to the resolutions that we attached with your agenda item.
Let's take a look at that so we can get a proper motion for these. So coming up with
Madam Chair,
Mr. Haynes?
excuse me, I didn't mean to interrupt you, but as far as the number 5, the resolution from Memorial Medical Center, it currently states that that we would be sending as a match 8.9488, and what we're recommending is that they get 8,757,176. So that's the change in the resolution. And 881, 340, 969. And then the total is still going to be less the eligible amount of 40,637,000. So that number's still fine. So for resolution under tab 9, if it could be amended to state public funds up to 8. I'll get it here.
Mr. Haynes, wouldn't it simplify it just to call it by method and we'll work out the numbers that are attached afterwards? Those are long numbers and chances of
number 3, and then we'll make the adjustments.
All right, that'd be perfect. Do we need a separate motion then to amend the resolution and then one to get the resolution, or can we go ahead and do the resolution as amended, accepting it as per method number 3?
Well, there's 2 resolutions, so.
Well, we need at least 2. Do we need 4 or do we need
No.
2? Okay.
No, you only need 2.
All right. I'd like to entertain a motion to approve item number 5, which is a resolution to provide certified public funds to facilitate Memorial Medical Center request to the state of New Mexico from the Seoul Community Hospital Provider Fund as per method 3.
So moved.
Second. I have a motion and a second. Any further discussion? Hearing none, what is the will of the board, Mr. Ellens?
Commissioner Cavanis?
Aye.
Commissioner Garrett?
Aye.
Commissioner Benavides?
Aye.
Commissioner Craling?
Aye.
Madam Chair,
Aye.
the resolution is approved.
Thank you. Moving on to item number 6.